2, 1.
Hey everybody, it's Dr. David. So it's nice to gather again. Welcome for those who are their first time here. Welcome to my YouTube channel, Dr. David MD. Besides the different videos that I put out through the month, we do this once a month, Ask Dr. David Live, where we have first our Patreon members, subscribers who have their first priority for questions, as well as people who are subscribers to our newsletter and the general public as well. Some people have submitted questions already. Other questions I will be taking live. As far as a quick disclaimer here, anything that we talk about today does not constitute a direct doctor-patient type of conversation. Everything that we will talk about is in general terms for educational purposes and should not be a substitute for a provider patient relationship. And of course, if you have any questions and you are a patient of ours or wish to be a patient of ours, we'd be happy to answer any questions and facilitate things. And of course, if not, then I would refer you back to your doctor. Okay, so we are getting some questions, and so we're going to go through those first. This moment is loading up here. Or is it on here? Hold on a second. There's supposed to be a chat button here. Here, chat. There we go. So I'm waiting for the first message to be coming up. Yeah. Oh, yeah. Something that I did forget to mention, that if you are out of the state of Florida and, I do educational consultations for those who are not in Florida and therefore cannot establish a doctor-patient relationship, but we do offer educational consultations so we can answer lots of different questions and work with doctors and help people understand their lab tests, etc. Okay. So first question. Are you aware of any alternative colonoscopy prep that does not involve taking Miralax and Dulcolax for someone that has had a colonoscopy in the past? Could someone taking plain magnesium citrate powder with water instead of prep completely clean their bowels out? And what dose would that be? Okay, so there's a standard prep that needs to be done for have a clear enough vision by the gastroenterologist who is performing the colonoscopy. Okay. Yes, one can certainly take enough magnesium to clear out anything. I don't know what that particular dose is, and nor do I know if it would clear the field, if you will, clear the screen, in order to give the GI doctor what they need. Okay. Now, while I have talked in the past and do have concerns about a person taking Miralax long term, which is unfortunately something that I do see some GI doctors do, although it clearly does state even on the package label that it's not supposed to be used long term. Okay, but at the same time, if a person has to take take Miralax like over a day in order to do the proper prepping, I don't have that same type of concern as I would have if somebody was taking it long term. So, I have had to do this myself a couple of times. I took Miralax for those times, again, not using it long term. I didn't have any problems. So, I mean, the answer is yes, in theory it can be, but I haven't seen any type of dosing that would tell me, yes, this is something what a person should do in lieu of, in order to make sure. So I guess one could always ask the gastroenterologist if there may be some other type of prep if one really doesn't want to use that particular medication. I'm not as concerned about Dulcolax either, really, again, just for short-term usage. But again, for short-term uses isn't something that I have over concerns about. So sorry, I couldn't be more specific there, but that's the way I'm seeing it. Okay. Could someone taking plain magnesium citrate powder? Oh, wait a minute. That seems to be the same question. Oh, I'm sorry. Yes. All right. So next question is being loaded up here. What is the safest maximum amount of CBD that can be given to a teen on the spectrum per dose? Any information? Okay. So now, first of all, any information regarding this, again, it's not specific to an individual. There are, there are some patients who need much higher doses of cannabinoids, as with other types of things, SSRIs and other medications as well. So this is a general concept here. Okay. So first of all, really isn't such a thing as too much. Now, the most that this has been studied is using the Epidiolex, which is the prescription CBD that is FDA approved for people who have intractable seizures, certain types of epileptic conditions. Okay. And a starting dose, according to the package insert, is 2.5 milligrams twice a day per kilogram. So that means if a person weighed 110 pounds, 50 kilograms, that would be over 100 milligrams twice a day as a starting dose. And they do say that it can actually go up to 10 milligrams twice a day, so 4 times that amount. So, now again, I've never seen that type of dosing being used. For that matter, unless somebody was getting the Epidiolex covered, I don't know how anybody would afford that. The Epidiolex, which it can be useful, but it is an isolate of CBD. So it doesn't have any terpenes in it, doesn't have any other minor cannabinoids in it, doesn't have any THC in it for that matter as well. It does have some sucralose in it if people are trying to avoid artificial sweeteners. But in terms of that is concerned, so, typically that's why we always talk about starting at a lower dose and working up gradually. But there's not, I wouldn't say now, I was actually reviewing for a patient earlier today, coincidentally, a question regarding, what kind of dosings would cause liver toxicity of CBD. And the best that I was able to find was in mouse studies, and they were giving 600 milligrams per kilogram that could cause chronic problems, over 2,000 milligrams per kilogram for acute damage. Now, again, we're talking about doses in a human being because obviously even a 1-year-old weighing 22 pounds is 10 kilos. And of course, that would be 6,000 milligrams of CBD as that starting point. So again, for all practical purposes, the answer is no. There's really no such thing as too much. Okay. Would I say that if somebody got up to about 100 to 200 milligrams twice a day and didn't see a difference at that point, that's probably, this is not the answer. Yeah. And realistically, I rarely go above 50 milligrams per dose, up to 3 times a day. Before I start bringing in the other cannabinoids, I've talked in the past that there could be other cannabinoids. And again, we weren't talking about what specifically this was needed for, but, certainly for people with anxiety or depression or panic attacks, OCDs, bringing in CBG, which often works in combination with the CBD. Sometimes that can be really helpful. And also, if for nighttime, I know I've talked before about CBN being used in combination with CBD. And of course, there are some people, if they're looking to use cannabinoids, that sometimes bringing in THC is needed to kind of round out everything. So really, it's such an independent, individualized type of thing. But, as long as one is making small jumps, as long as people are keeping a record of what they're doing and how much and what the effects are. So I think that's also really important. You may realize, hey, things were better a month ago. What was I doing back then? I don't know about you, but there's no way on earth that I would know what I was doing a month ago, especially if I had made 3 or 4 changes in between now and then. So yeah, but overall, we're talking about some pretty good safety margins here. Okay. Now, one other aspect about that is, we use cannabinoids to help balance out the body. But it is also important to realize that for most people, it isn't dealing with the root cause. Now, in autism, that there could be an exception there because there was some research back in 2018, 2019 out of Israel that measured the endocannabinoids. So these plant-based cannabinoids, THC, the CBD, NGs, and all of that, those are obviously made by the plant. Now, part of the reason why this is such a successful treatment, though, and I know I've shared about this before, is that we all have what are called endocannabinoids, cannabinoids that we make inside the body, like endoscopy inside endocannabinoids. And we all have endocannabinoid receptors, which both our endocannabinoids as well as the plant-based cannabinoids act upon. Now, when the study had showed that people with autism actually had a lower level of one of the endocannabinoids than their typical peers. So there could, in that particular situation, be getting to a root cause of deficiency state. The only thing is that there's no lab test that I'm aware of that you can commercially do to see if that is actually true in any one individual. Okay. So here is another question coming in. Okay. Our teen who is on the spectrum struggles a lot with being able to fall asleep. We have tried CBD in the past, doesn't help much. We are concerned about giving him melatonin since it's a hormone and its effects on boys during puberty years are not well known. We have been giving him passion flower, L-theanine, and GABA prior to bedtime, and it seems to help some. Is it safe to use passion flower in that dosage long term? In a dosage long term, is it safer to give a teen boy melatonin or passion flower? Okay, you got some good questions here. Okay, so first of all, passion flower being an herb, um, the research that I've seen on this talks about long term being 12 weeks. Most studies that are out there, that's all they're talking about. So you're not going to find many studies that are looking years in the past in the future. Okay. But it is, there are doses that are typically talked about anywhere from 250 to 750 milligrams or so a few times a day. That is considered a generally safe dose. If you look it up, that's kind of where even, mainstream sources will tell you that. And so it does seem, but obviously I can't give you an answer for the very long term, but, certainly it does seem to be one of the safer things that are out there. Now, in terms of melatonin, okay, this is an interesting question. Now, there are some laboratories, some of the holistic labs that can measure melatonin. It's done more by saliva, sometimes by blood. So there is a way of seeing if a person does run low melatonin, and similar to if a person is low in insulin or other hormones, then a replacement to make a person into the normal range certainly seems like a pretty safe thing. Now, in terms of the overall use, though, in part, I think it depends on how much is being needed. Now, typical doses, some people can get away with a half a milligram, 1 milligram, 3 milligrams. Once you start pushing 5, I've seen 10s, I've seen 20 milligrams, and that to me does seem like a much more of a superhuman dose than those lower doses. And that I would have more of a concern about, just because obviously if you're talking about giving, 7 to 40 times the what's considered a low dose with those types of implications, because also if you do look at the medical literature, it's mostly talking about those lower types of doses, not the bigger types of doses. I mentioned before, again, with CBN being another thing, 'cause sometimes the CBN plus CBD can be a helpful thing if the CBD alone is not working. Sometimes in our patient, the only thing that does work is a combination of those with maybe adding some indica on the THC side if a family is comfortable doing that as well. But overall, I'm not so concerned about low amounts of melatonin. I'm not really concerned about passion flower at all, although it would be great if we had 3-year studies that are out there. Okay. Now, of course, an important thing here is working with an expert, consulting with a physician such as myself, a provider that knows this stuff, that can work you through it, that can talk about safe products, that can talk about dosing schedules, et cetera, how to use it, et cetera. So, of course, being that this is just general advice, consulting with somebody who knows what they're talking about, that can be very helpful too. Okay. Next question. Do you take CoQ10? I do take CoQ10. I take about 100 milligrams of ubiquinol per day. So ubiquinone is the form of CoQ10 that you will see in most supplements. Ubiquinol is the activated form of CoQ10. Now, it's thought that as we age, our ability to convert ubiquinone into ubiquinol starts to decrease. And so that's why, so if I'm dealing with a kid, and of course there's chewables and liquids and all of those. And, if I'm dealing with a kid who I've documented a deficiency on, or there is some reports in the literature that getting CoQ10 levels up into the higher end of the reference range. So the kind of like 2 and above, around 2, that's considered more the cardiac protective dose. Like for if a person is taking a statin, getting the level up around 2 seems to be the cardioprotective dose. But that's kind of that's actually, and so that's a level I meant to say. So, but that level there has been shown in people with autism that may be helpful on their behavior and cognitive function as well. But as somebody who does have a family history of cardiac disease, I have run some low high blood pressure, although I'm doing really well with that now. It is something that I do make as part of my routine. Actually, I need to check my level to see where I'm at. So that's a good reminder for me to do that. But yeah, definitely something that I take on a regular basis, but I take the ubiquinol form. Are there any supplements that can help women who deal with dizziness of unknown cause? Already has been checked by ENT, neurology, etc. Okay, well, obviously, to make a recommendation for something that's an unknown cause, that's obviously a little bit being put behind the eight ball in the first place. Okay, but before I would even want to proffer an answer for that, I would need to know a lot more about a person's history. Some people will use the term dizziness when they're actually talking about spinning, like vertigo or something like that, right? Some people can use it to more mean just like lightheadedness. So, what are some of the things that I would be making sure of? First and foremost, before I do anything, I want to make sure that a patient like this is very well hydrated. Okay. We talk about at least 8 cups for adults, but in a patient like this, taking an adult who's may have some more ongoing issues, even 10 to 12 cups per day. I would want to, talk about doing an electrolytes as part of that as well, just to make sure that the problem isn't due to some type of hypovolemia or low blood volume. That could be something that's chronic if a person's not getting it. But in terms of like what can a person do, I certainly would want to look at all of the different functional medicine types of tests that we talk about, looking for the different imbalances. Because again, you say it's unknown, but to me, unknown if it was worked up by a more traditional physician may not be unknown if a person were to check for the types of deficiencies that we look for, that we look to see if, would a person potentially be reacting to a particular food, and could an elimination diet be good? How is their microbiome doing? Are they very well off on their good levels? Are there any bad guys growing as well? So, but it's such a broad question to ask that I really think that would be something that would be best asked in a consultation type of mode, where really all of those details can go. How is a person sleeping? How is a person's stress level? How is a person being able to exercise? Could they do exercises potentially in one place like a pool that may be more settling to them than just going out and running or trying to do some high intensity type of interval training or weight training, etc. So, all of those things that we talk about being part of a healthy, holistic lifestyle come into play. Didn't even blood sugar levels. How's the urine been? I'm assuming those types of things would have been checked by a more traditional doctor. But again, without knowing more about it and without knowing, to the level of tests, that's kind of where I would be thinking. Okay. Would taking hormones be safer for a woman dealing with premenstrual symptoms? Is it true that taking progesterone increases the risk of cancer? And are there any holistic alternatives or supplements with premenopause that can help with premenopause symptoms like fatigue, depression, dizziness, very long periods? Okay, so again, from a functional medicine perspective, of course, looking at all of those basics, the diet, the nutritional deficiencies, gut microbiome, etc. Now, also, one of the things that we do here in our practice is we actually look at the hormone levels themselves, right? So if a person was actually showing that they had suboptimal or they were deficient in progesterone, and getting them into a regular range would be different than just someone starting to take progesterone. Right. So I think it is important to kind of check to see what's going on. And of course, there could be some progesterone sensitive types of conditions. We know that breast cancer, ovarian cancer, there can be sensitive forms of those. Of course, you're maybe talking about preventing that from happening. And so looking at family history. Are there any types of cancers that are hormone dependent, have, BRCA genes and other types of genes, pardon me, that are associated with hormone sensitive conditions, would be something that would be worthwhile looking at as well. Now, there are certainly supplements that people will use. I've seen high dose omega-3 fatty acids, magnesium and vitamin B6 can be helpful. I know vitamin D can be helpful as well. I've heard of some herbs, but I think that kind of depends on the individuality. So, again, working with somebody who has a keen knowledge about female hormones and menopause, premenopause. Now, as a pediatrician, this is where I get to pull the pediatrician card out and say, this is not an area of expertise for me at all, but that's why I have other providers in the practice who can answer those types of questions. But certainly, that is an art unto itself, right? And it's one thing that, for a child who has a thyroid deficiency, etc., or if puberty wasn't moving forward, and you look to see if any of the sex hormones were off. But even in that situation, I would be if I found those, and those are things that I test with, I would be wanting to work with a pediatric endocrinologist in that situation as well. So again, as with everything else, it's a very individual thing, but I wouldn't necessarily rule out progesterone right off of the bat just because of those concerns, but it's something to be mindful of. Okay. What is your medical view on using thermograms in place of mammogram for those wanting to avoid the radiation involved with them? Would a thermography scan be worth it in your medical opinion? Okay. So the medical literature, from what I can tell, is pretty strong that there is nothing that shows that thermography is even close to a mammogram. I realize mammograms are uncomfortable for some because of the smushing aspect of physicalness, whereas a thermogram does not require any physical touching of the body at all. But the thing is this: thermography, because it's measuring heat, could also be picking up some kind of infection or other inflammation. That's not cancer. But the bigger thing is this: it is not considered a very good tool for early diagnosis, for early catching it. A mammogram is considered significantly better at picking up micro, really small, first starting diseases. And of course, with breast cancer, as with any kind of cancer, we screen for it to try to catch things as soon as possible because of the potential for spread, for the potential that it could even be like precancerous, and there could be something that's seen there, but that it's not actually cancer itself and it can be dealt with before it's a problem. Okay. Now, one of the things that I also do know about mammography, since it is something that a woman would be doing on a somewhat regular basis, is I do know that they have figured out ways to do it with low amount of radiation. Okay, so obviously the kind of radiation that somebody may be getting in a CAT scan is higher, although now they figured out a way to do lower radiations in CAT scans as well. But again, if you're talking about doing something once a year, once every couple of years type of thing, relative to a regular X-ray, well, flying in an airplane from one coast to the other actually exposes a person to more radiation than a standard X-ray is. So everything is relative. You wouldn't want to be saying, "Hey, it's Tuesday, let's go get another mammogram." Right. But, if I was advising somebody, mammogram even though it's not a perfect tool, that is what I would be recommending to a loved one of mine. Okay. What tests do you perform in your office to inform the status of the microbiome and guide how the microbiome can be improved? Okay. So when we talk about the microbiome, we're talking about what's living in the gut as well as what's there to feed the gut. Okay. Um, I don't remember if I've ever shared on this channel before, but one of the things, a healthy microbiome, a person, the amount of live bacterial cells in their body, in their gut, is 10 times the amount of cells that we have that are human in our own body. Now, granted, these bacterial cells, they're much smaller, but in terms of just cellular count, we are 90% bacteria and 10% human by cellular levels, which is kind of a freaky thought that we're mostly bacteria walking around. Now, there's a couple parts to this. So, of course, we do a stool test that looks at the major types of flora, the Enterococcus, Lactobacillus, Bifidobacter. And there are even more advanced GI stuff that looks at all of them. My approach, though, is more making sure that there's enough of the good guys. Now, if we had been having this conversation 10 to 15 years ago, I would be talking all about probiotics. And of course, probiotics can be a very helpful thing, but we also know that we have many, many, many different types of strains and types of bacteria in our gut. Okay. And you'll find probiotics out there that have just one or two types of things. And I may use those short term. But I've been using 8 strains, 12 strains. There's now 20 to 25 strains in some of the higher potency products that are out there. But all things considering, if I was wanting to be most tending to a microbiome, I would be wanting to be focusing on the different fermented foods. There's about a dozen of them Each type of fermented food is more prominent in one type of flora, even though there's gonna be more than one in there. So, not just eating sauerkraut or not just eating yogurt, but having all of the different ones, some kimchis and kefirs and kombuchas, as many different types of fermented foods, bacterial-laden foods, that one can have, the more diverse the microbiome is, which is really what you want. Now, the other side of the coin is there anything pathological that could be growing there? Okay. And in particular, we're talking about things like yeast, candida. We're talking about certain types of bacteria. And yeah, a person can have salmonella or shigella or some of those types of bacteria, pathological E. coli, but those are usually short-term types of infections. But we also can find different types of Clostridia that could be longer term. Okay. Now, so a lot of people have heard that when you take too many antibiotics, and it's notorious in hospitals that one can get C. diff, Clostridia difficile. Okay. And that can certainly be a problem. That's something that can be around for a long time if it's not dealt with. Incidentally, a lot of the times we can just treat that with particular forms of lactobacillus flora without needing to use a pharmaceutical for that. Okay, but that's that one particular type of bacteria. And of course, there could be parasites as well. So that to me is actually the more helpful part of the types of stool testing we do, because they can identify all of those different types of pathogens. So, the panel that we do to look for everything, probably 30 to 40 different pathogens that are on that test. Now, also, one of the things that we also do is a urine organic acid test, but in particular, one that has microbial markers on it. Okay. So there are specific substances that could be made by yeast or could be made by bacteria that are not made by a human. And if the urine test shows those substances, since we have on pretty good authority that we are not yeast or bacteria, although they're living inside of us, that means that those pathogens would be inside the body and would, be warranting types of elimination. And then again, depending on the type of pathogen, obviously a person who has a yeast, a candida, would be taking more of an antifungal approach, whereas if a person having a parasite would take more of an antiparasitic approach. So again, doing that type of testing in order to see what actually is going on there, and then tending to the microbiome on the good side, that's really the way that I approach this overall. And usually we have a lot of success with that. Is there a holistic home remedy that you can recommend to treat severe IBS at home until my GI appointment in a few months? Thank you. Okay. So part of the answer to me would be what I just talked about. Is there enough cultured foods there? Starting to introduce those. Now, of course, if people have sensitive tummies, you may need to start off really small, like maybe of a quarter of a teaspoon of sauerkraut juice, but not chowing the whole thing down, and starting to introduce those things, because they give you a little bit of a shock to the system, and you kind of do want to work those things through. Okay. And of course, I have seen people who have been giving diagnoses of IBS who actually do have more issues on the functional medicine side with their microbiome, and the good guys versus the bad guys. Now, another thing, though, that I would absolutely be looking at would be an elimination reintroduction diet. So I would be wondering if there are foods that may be triggering the individual. And so our elimination diet, there's a list of foods that are the most common foods that people react to. We also say that if there's any foods that you crave or eat a lot of, for 3 weeks, you avoid it all. You change your diet around. I know it can be hard, but you kind of remove all of those potential instigators. If that is the answer, it should be obvious by 3 weeks, often by 2. So then, assuming that a person does get better during that challenge, that elimination part, then it becomes the reintroduction part. Now, a reaction to a food can take up to 3 days to be seen. So when we reintroduce the foods, we like to do it every 4 days, just to make sure that that there's not going to be any kind of overlap. Okay. And it should be like a pure food. So if a person had avoided all of the food, a pizza would not be the thing that you'd want to introduce first, because there's a lot of different things going on in pizza. For sure, the dairy, for sure, the gluten, the wheat, etc. So what you would do, I would introduce a small amount of milk if I was going for dairy, or a piece of just very plain bread. Whole wheat's fine. Wonder bread for just the challenge, etc. And then kind of working up from there. But those are definitely the two things that I would be most considering of. And quite frankly, when people ask me whether they should go see a GI doctor, those are the things I would do beforehand, anyways, before getting scoped. And of course, sometimes when a person does get scoped, though, it's not just IBS. There could be other types of things, celiac disease. So again, I don't know whether if the person had been tested for celiac disease. That, of course, if they're gluten-free and avoiding it, that would treat that anyway. But that kind of thing can be seen. Crohn's disease, ulcerative colitis, other types of diverticulitis, as well, can be seen on a scope that wouldn't be able to be seen without direct observation. Could you please explain and give me examples on how the results of the Max Gen test can help you decide treatment, and if it would be dangerous to assume that a child has a mutation? For example, since MTHFR mutations hinders our body's ability to transform folate into methylfolate, is it bad to supplement with methylfolate if you do not have the mutation? Fantastic. And in fact, I have been one who have argued that if all multivitamins did have methylfolate in it as opposed to folic acid, we would probably do a lot more good for society. Now, there is some parts of that. Okay, not everybody will tolerate methylfolate. So one of the things that we also see when we do this max function test are COMT, C-O-M-T genes. And there are 5, and the more COMT genes that a person has, the more likely that they will have sensitivity and be problematic for them to take too much methylation. Right now, the other question, even with the MTHFR, is what mutation/mutations are there? Right, so there is the minor A1298C, and if you have just one of those in a typical, a non-mutated MTHFR, that may have no issues whatsoever. Of course, you get one gene from your mom and one gene from your dad, so 2 may be a little more impactful. But it's the C677T, the major one, that is more problematic. And of course, it's most problematic if there's 2 of them, less but still very problematic if there's one minor and one major. Okay. And the reason why it is important is because I also use this test to determine how much methylfolate a person needs, or in the person who has sensitivity to methyl groups, if they may need something like folinic acid and instead, right? So I'm giving more methylfolate to a person who has 2 gene mutations, especially if it's the C677T, versus if it's just like a 1 or a double A1298C. So that's one example. Now, there are other genes on there that could suggest other issues. Like, for instance, the genes about glutathione, okay, glutathione peroxidase, glutathione synthase. These are if their mutations are there, our body will struggle to make glutathione or to reactivate it. So we've talked about how there's oxidized glutathione. That's the inactive form. You need to reduce it, antioxidize it, in order for glutathione to be active. Okay, so if a person has one of those genes, they probably do need to take reduced glutathione directly, right? Now, if a person doesn't have those genes, they may very well even be able to take N-acetylcysteine, which is the direct precursor, the one step before glutathione, and that person may very well be able to make glutathione. So that's another example. Okay. Now there are quite a few others. Like, there's markers on there, SOUX, that may mean a person may need more molybdenum. There's a marker on there for SOD, superoxide dismutase, which besides glutathione is probably the second most important antioxidant in the body. And if a person has that, they may need to take SOD. Okay. So, and I can give you quite a list for this as well. But if you said in a general purpose, if there was a multivitamin that had 400, maybe 800 at most micrograms of 5-methylfolate in it, and the person tolerated it, I think you're fine in that situation. But again, there could be so much more to it. We talk about vitamin B12. There's markers that tell us that a person may not be absorbing it well. A blood test may help for that. But if a person has like an MTRR mutation, for instance, they may not be able to methylate the B12 and need methyl B12. There's another mutation that can make it that a person can't turn B12 into another form called adenosyl B12, adenosylcobalamin. Pardon my hiccup. And so, there's about 70 different markers that would be there. And so, and there's not any like one vitamin that you could just take that's going to cover everything. So, that's the reason why, but I realize some people can't afford it, accessibility, etc. But again, for a general multivitamin that doesn't have high amounts of methylfolate, I don't think you'll go wrong with it. What supplement would you recommend to reduce high blood pressure? How does one decide if it's high blood pressure or anxiety, i.e., white coat syndrome? Do you think that spikes in high blood pressure can cause damage? My diet is clean and my blood work shows it. Okay, so let me first answer the white coat syndrome or the anxiety side. Okay, so first of all, no one should ever be given a diagnosis of high blood pressure hypertension based upon a single reading, especially if it's in a doctor's office. It is incredibly well known that people are more likely to be nervous. Are they going to get all their questions answered? Are they going to remember all their questions? Oh, is this doctor going to give me bad news? Is he going to find something? She going to find something? There are all of those possibilities that can make a person feel more anxious. Okay, so whenever I'm in Publix, or in a pharmacy, I'll pop my arm in one of those there. But checking your blood pressure at different times of day can also be very helpful, because when one's talking about like ongoing hypertension, that's where the problem is, right? A person who does a wind sprint may very well increase their blood pressure temporarily, but in that situation, it should come down. So really the question is more about, so in terms of that type of spiking, or that spiking that you may get just from the long term, should be fine for most people. Now, again, a senior person, an elderly person who has serious heart disease, that could be a little different. But our hearts are made to deal with that. Our flexible blood vessels are made to handle that. Of course, when there's blockages and other things, that changes things around separately. Okay. But in the situation such as this, our blood pressure will go up if we do something exciting. If you see a scary movie or something like that, your blood pressure may be going up when you're on edge. Or if you're at a concert dancing around and, you're so excited because it's your favorite band, your blood pressure is probably going to be up in that situation. So it's really the ongoing that is more of a concern. Okay. Now, in terms of supplements, there's a few that I like to use. Number one, magnesium. Magnesium can lower. In fact, magnesium sulfate is used when if a woman has high blood pressure pre-eclampsia, in OB suites, they can even give a intravenous dose of Epsom salt, to the salt itself. A magnesium sulfate is what it is, and that's something that can be given. So magnesium does have that kind of calming effect, and it can lower blood pressure. And of course, there's different types of magnesium. Some have different effects on the intestinal tract, of loosening stool or not loosening stool. But certainly that is one of those things. Higher doses of omega-3 fatty acids can make a difference as well. Now, I've talked before about, and one of my favorite supplements overall is L-theanine, derived from green tea. L-theanine has been shown to lower blood pressure. And cannabinoids, CBD, and I've seen THC do too. I have had patients who have come off of their blood pressure medicines once they've gotten onto a good regimen of the cannabinoids. Now, of course, that's not everybody. If a person gets more anxious because they take cannabinoids, which can sometimes happen, then of course that would probably go in the opposite direction. But those are the types of things that I would typically use for high blood pressure. What supplement, if any, would you recommend for a vegan with low iron that is still breastfeeding? Hopefully, something non constipating. Okay. So, while iron, of course, is found in meat, it's a pebble, right? A really small pebble, but iron it's a metal, right? So, just in and of itself does not mean that it is a iron supplement would be a problem for a vegan. Now, of course, depending on the capsule, if it's a gelatin capsule, right? That could be a problem because that's usually not vegan. I think it's never vegan. But if it's a veggie cap, that could be different. Now, the form of iron that is the least constipating is called iron bisglycinate. The brand name and it's actually, you'll see, it's not just one brand, but the copyrighted name, I guess you could say, or the permit name on it. Not permit. The what's the word I'm looking for? The copyrighted, whatever, I forget the word. Sorry, is called Ferrochel, Ferrochel. Okay. Now, but also taking vitamin C with iron is also helpful to decrease the potential for constipation. 2 reasons. Number 1, it helps the iron be absorbed more in the small intestines, which is where it gets done. So there's less iron passed along to the colon, which of course that's where constipation takes place. Now, also, vitamin C in and of itself can be also a stool loosener. So, if a person was experiencing it, there is even something called dosing till bowel tolerance, where you're not overdosing yourself unless you get diarrhea from it. And even at that, you're not truly overdosing because you're just letting the river pass through you at that point. But certainly, if iron was causing constipation, one could start pushing 250, 500, 1,000 or more milligrams of vitamin C to see if it opens it up. And of course, magnesium as a stool softener can also be used if that were to be a problem as well. Okay. What are your thoughts on garlic? And have you seen any interactions with garlic that would be a problem with medications? Pardon me. And I'm going to take a quick sip of water. Let me ask that question again. What are your thoughts on garlic? And have you seen any, are there any garlic interactions? Now, garlic is an incredibly safe substance. There are a few medications in the blood thinner realm, like aspirin, and especially if it's higher dose, warfarin, that because garlic can have some blood thinning properties. It's not a common thing, but that would really be the main thing. But besides that, there's really no other contraindication. Now, from a food perspective, love garlic. I put it on almost everything that I do, and eating garlic cloves that have been roasted, that's just such a wonderful thing to spread onto bread. A quick funny story. There was a restaurant that I used to eat at when I was down in South Florida, that they would give you the garlic cloves roasted, and you just spread it on the bread, and it was just the most delicious thing ever. And I had clinic the next morning, and there was this little 3-year-old boy that I was seeing, and I get up to do the examination, and the boy says, "Man, you stink." And I'm like, and the mom was like, "Son, don't say that. That's rude." And he said, "But mom, he stinks." And I said, "Well, actually, I'd gone to this restaurant that we all knew about, and that's me. That's my garlic." And I made a point of never eating that much garlic before I would examine a patient again on the next day. But yes, it can be very helpful on antioxidant levels. It's a really nice same thing to do. It does have antimicrobial properties. I do know people who do roasted garlic and will eat roasted garlic in the first signs of illness. That I have a family who swears by that. That's their main thing that they do. So you can't really get in trouble with garlic in almost any circumstance. And again, from my perspective, the more the merrier. Hi, doc, patient of yours. What would cause a sudden tingling in the left arm from mid-shoulder into the fingers? Like when you hit your funny bone, but it's constant and won't stop. Okay. So just as an aside, a first starting point, and I don't know what the person's situation is, but of course it should be known that the sign of angina could be manifested as tingling going down the left arm. So if there's any concern about that whatsoever, certainly worth being checked out. You would certainly think if this was a long-term thing, though, that's probably not what's going on, because you would have seen a problem by then. But just as a starting point, make sure that it's not a cardiac thing. Okay. Now, of course, there's lots of different things that can cause this, though. A person could have like a neuropathy. So could there be an impingement in the where the nerves that go down into the arm, the thoracic nerves, how they go down to the arm? So there could be an impingement and there. Right. There could be there could be muscle spasms that so let's say the nerve is running through a muscle. So it may not be at the spinal. It could even be some kind of impingement somewhere else. That's again making it happen. Similar to like when a person has sciatica, where there can be like pain shooting down the leg and tingling itself. Right now, yes, there could be other types of metabolic issues. such as diabetes, although usually the type of peripheral you'll feel it on the feet. It wouldn't likely just be one limb. It should be kind of elsewhere, but probably not a bad idea to make sure that there's not any hyperglycemia going on there, checking a urinalysis for glucose there, or doing a blood prick then to kind of see what's going on there. That would be some of the things that I'm looking at. Depending on, mentioned in terms of mid shoulder on down, I personally did have that issue, but it was more carpal tunnel, but it was really just here on, it wasn't up here. Carpal tunnel really wouldn't make anything like that happen. And again, could there be any other kind of dysfunctional medicine types of deficiencies that can be there as well? Sometimes taking too much vitamin B6, especially if there's not enough magnesium. Vitamin B6 can cause a peripheral neuropathy. And so that's what I would want to know if a person was taking high amounts of B6 without magnesium. That could be an issue too. Can ADHD be diagnosed by a functional neurologist? Okay. Now, the diagnosis of ADD itself is solely diagnosed based upon symptoms. Okay. There could be root cause issues that could be all kinds of things found in a functional medicine perspective. But there are standard questionnaires called the Vanderbilt questionnaires that one can fill out. And what really should happen is that both a parent, and also part of ADHD or ADD, if there's not the hyperactivity, is that it should be present in multiple scenarios, multiple locations. So if it's happening at home but not at school, or school but not at home, then that really isn't the part of that definition. Now, if it's an adolescent who you're screening, there is actually a questionnaire for them as well. So there are certain numbers, and there's a scoring system and all of that would basically give the diagnosis. Okay, so that's really the only way that it'll be diagnosed. I know people have talked about on different types of brain scans, and there's something associated with it. But just you could have a brain scan that shows this particular abnormality associated with it. But if a person doesn't have the disease, then the condition, then that's not it. So all types of things that can be done in terms of treating it, but the diagnosis itself is a psychological testing, whether it's with a pediatrician, neurologist, developmental pediatrician, psychologist. That's where the diagnosis comes. But we in our office, we use these forms, we send them along and we score them, and then we kind of know what's going on. If a person is taking a statin, would it be best if they take a higher dose of CoQ10, or would 100 milligrams suffice? Okay, so this does come back to some of the previous CoQ10 questions. First of all, is it ubiquinol versus ubiquinone? Ubiquinol being the active form. So, ubiquinol would be a better option than ubiquinone. Okay, some people do need more, and that's why I like to get a blood test. And I like to get the blood level in the 2 range. Now, if you look at the reference range, they'll typically say that normal is greater than 0.39, I believe. So if you have a 0.40, it wouldn't be flagged as high. And if a person wasn't on a statin or wasn't having any cardiac issues, that could be fine for them. But for me, it's really about what is the level and doing whatever it takes to get there. Okay. All right. Yeah. But of course, I would ask the doctor if you're taking a statin about it. I'll tell you another quick anecdote. 10, 15 years ago, I had got there down at Capitol Grill. There was a dinner presentation being put on by a cardiologist to talk about statins. And I figured, I didn't know much about it. I should go learn about it. Hey, a nice meal at Capitol Grill, not too bad either. And so this guy turned out he was a shill for the drug company. And the miracles of statin medication, and everybody should be on statins. He's on statins, etc. And so at the end of his presentation, when it came to the question and answer period, I said, hey, my understanding is that a person can run into problems with statins if they don't have enough CoQ10, that it could be associated with deficiencies. CoQ10 can actually be protective. Yeah, I noticed you didn't make any mention of CoQ10. What is your take on it? Of which he then said, oh yeah, CoQ10, it's really important. He says, I take 200 milligrams a day myself. Of which I then said, and I'm sure I didn't I didn't get much love from this comment. I said, you have this room full of doctors and providers here who are listening to everything that you say. And if I didn't ask you that question, not a single one of them may have known about this. Why is this not part of your standard presentation? Why don't you have a slide on that one too to protect the people like you do yourself? And there was definitely some grumbling, and I think there was even some applause from the group there. And that was kind of a little turning point there. And then I think he kind of pivoted and we went on. But yeah, that talk about how sad that is, that, talk about the drugs. Don't talk about what could spare you from the drugs. Hey, what are you getting paid for? He wasn't getting paid by the CoQ10 company, I guess. So yeah, there's that. Have you seen the new research on COVID during pregnancy and brain development? How concerned should pregnant mothers be if they get sick with COVID? Okay. First and foremost, everything that I am seeing is that the issue is about inflammation. Okay. So that's why, as part of our COVID protocol, we talked about all types of natural anti-inflammatories, things like glutathione, higher doses of omega-3 fatty acids, antioxidants, which of course deal with this, things like vitamin C and some of the B vitamins, etc. You can't be too high with them in the pregnancy, but certainly things that you can do that. So anything that can reduce inflammation, getting out in the sun, not just the vitamin D from the sun, but the infrared rays that come from there, so incredibly helpful for stopping longer term problems with it. But again, you say, how concerned should a person be? Well, what are you going to do about it besides what I'm just talking about, right? So obviously, with everything like that, we can certainly talk about all kinds of things that I'm concerned about that people are exposed to during pregnancy, during lactation, etc., from the forever chemicals that we've been hearing about, from the Teflons on up and the BPAs that never leave our bodies, no matter how clean we are. It's in there. We're all being affected by this. Hormone disruptors that cause that as part of what happens there is too, right? Of course, heavy metals and other types of things. So certainly if one had a choice of not getting COVID during pregnancy, taking whatever extra precautions that a person wishes to take, certainly not a terrible idea. But at the same time, that's kind of what my take would be. But, would I be concerned if a person had influenza or some of the other viruses, Epstein-Barr virus during pregnancy? I would be concerned about too. Herpes virus for sure could be a problem. So everything is relative. How, being on an anti-inflammatory diet, or really, if you get COVID, avoiding all of those pro-inflammatory types of foods, the sugars, the saturated fats, the words we can't pronounce on food labels, right? Getting as clean of a diet as possible. That can, of course, affect our intestinal inflammation, and all of the inflammation and the cytokines that are there too. And anything that you do, that I kind of be thinking of a cup runneth over when it comes to inflammation. So the more different ways that we can tackle inflammation, I think, is also a really important thing for having the best outcome from COVID, whether you're pregnant or not. Okay, I think this is our last question here. All right, wow, we've almost got an hour. How about that? Do you think wearable technology like fitness trackers and smartwatches can really help somebody optimize their health and safety? Yes, there are some really important things that can come about that. Okay, first of all, in terms of a heart monitor, not just like wondering if you're walking around with too fast of a heartbeat, but even and where I mostly find this useful from my own personal lifestyle is when I'm exercising. Okay, because I want to be pushing more towards the upper end of my maximum heart rate. As I've talked about on the channel that I do follow, Orange Theory, which is trying to keep your heart rate at least above 84% of your maximum heart rate. Maximum heart rate is 220 minus a person's age. So 84% of that, and trying to get somewhere between 12 to 20 minutes of an exercise regimen on a day in that level can be very helpful for increasing metabolism even after you start. Now, even after you stop exercising, I should say. Now, another thing that I know that a lot of these can be tracking is sleep. Okay. How much sleep are you getting? Movement during sleep, which is again sign that a person is not getting restful sleep. How many hours of sleep are you actually getting? Some people are kind of up and they're kind of half stirring, half awake, etc. But of course, if you're using something that has an app on it that tells you how many hours of actual sleep you're getting, I know people will do this with wearable rings like the Aura Ring, etc., as well, and then this gets downloaded to an app. But those certainly can be helpful from those types of perspectives. Okay. Yeah. Now, yeah, that's true. Thank you, Shari, for kind of chiming in here. Certainly, other things that if people who are more medically fragile, a one of those types of devices can obviously tell if you fell. Right, they can tell if I got into a car accident. Those types of things. They can alert emergency services if a person were to fall and be unconscious. God, amazing technology can do that type of thing. So those types of things. Now, of course, if a person does have a history, maybe they have a history of AFib, like a cardiac arrhythmia, and maybe they're in and out of it. Maybe they're taking a medication that is supposed to help treat that. Right. Well, catching an arrhythmia, knowing how often a person is going into an arrhythmia, we all have some arrhythmias that are considered normal. There's always heart, beat to beat variability. But again, if a device is catching, hey, you're going through a prolonged run of something here, that could be a sign to let a cardiologist know that, hey, this is going on, as opposed to just when you go into a cardiologist and they do a stress test or an EKG or that type of thing. That's obviously that particular moment in time, but you may want to know for the long term as well. All right. Well, thank you everybody for joining. Please help spread the word about not just this show, but for what we're doing all over social media. If you're stuck around this long, I'm assuming that's because you're really interested in the types of work that we're putting out. But we really, the reason why I did this channel in the first place, while we started Dr. David MD, is because we realized that the advice that I give seems to be kind of desirable. Right. And so share it with other people. We want to be able to get the word out there because, of course, with all of the algorithms of these social media platforms, the more views there are, the more that it gets pushed up on the algorithm for people to be, for other people who may not be looking for us to actually find it. So again, please join us on as a member on our Patreon. Subscribe to our social medias. I'm doing TikToks now. I'm not doing any dancing, although my staff says someday we should do that. Maybe we will for fun sometime. But I do these more quicker 1 to 2 minute types of videos. There are things that are going on in a particular day. A little bit more of a Dr. David Reacts. That was a video segment that I was doing on YouTube that I've moved over to TikTok, etc. But yeah, so just come check us out and share it with everybody. Share the love. Have a great day. Oh,